Dr. Wayne Jonas, who will be our first speaker today. He is the Executive Director of the Samueli Integrative Health Program and a practicing family physician. He's a retired Lieutenant Colonel from the Marine Corps of the U.S. Army and the former NIH Director of the Office of Alternative Medicine. He is widely seen as the expert in developing evidence-based research on pain, stress, and resiliency. He likewise has a host of honors a mile long, but of those, he's been given the Pioneer Award by the American Holistic Medical Association and the Pioneer Award for Integrative Healthcare Symposium. He is the author of How Healing Works, and he will start off our plenary session this morning by discussing From Soap to Hope, implementing integrative care into practice. I welcome to the stage Dr. Wayne Jonas.
Good morning. I apologize, my voice is a little hoarse. I'm just getting over a cold. It's nice to be tall, isn't it? You can kind of go up through any angle that you want. It's a great pleasure to be here. I'm actually honored to be able to say a few words this morning. Last night you had some amazing speakers and presentations. Dr. Michael Fine, who told you about how we're all participating in a wealth rather than a health system. And I say we are all participating in that because simply by engaging in the system, we get sucked further and further into the economic components of it, when most of us, I think, probably all of us in this room, went into it for the human components of it. And how do we do that? How do we actually keep one foot in the system itself as it begins to crash and burn? With, as he described data, I'll show you a little bit here, but he did it much better than I could do, about a system that no longer heals and has not embraced or embodied or paid for or provided time for healing. I think I, as a family physician for over 35 years, now realize that I actually went in it because I wanted to be a healer. My father was a chaplain, and he spent a good part of his career working as a hospital chaplain. And he would go into the hospital every day, and I would wonder what he was doing. So when I got accepted to medical school, I actually got accepted to go in early, and it allowed me to do some non-scientific things. I said, I need to find out what a chaplain does in the hospital. And so I found a CPE program at a seminary that allowed me to come in as a student chaplain for 6 months and go through CPE, part CPE training before I went to medical school. And so here I am, 23, and I am the student chaplain in a hospital. And I'll never forget my first client, not a patient, a man who had metastatic lung cancer and was in the hospital on IV morphine for pain management. And he had asked for a chaplain. He said it was fine if a student came up at first. And so I came up and I went in his room, and he looked like he was asleep. After all, he was on IV morphine. And I sat down next to his bed and just wondered, what am I going to do? He didn't seem to be paying any attention. He didn't seem to be awake. And I'm supposed to be there to somehow minister to him. So I sat there for a little bit and thought, boy, I'm off the hook now. I'll just say a few prayers, and I can go back and report back to my superiors that I ministered to him. So I've got my eyes closed, and I'm saying a few prayers and probably drifting off into other things. And suddenly I feel his hand on my hand. And I'm startled, I look up, and he's reached over, and he's put his hand on my hand. He's looking at me, and he says, son, you're going to be okay. That's when I learned that healing wasn't from me to you. He was healing me. He sensed my anxiety, my nervousness, etc., and he reached out and touched me. And this is the way healing is. Healing emerges out of wholeness. It emerges out of dipping down into the deep parts of our soul. And I use that term deliberately because we all actually have one, whether we can measure it molecularly or not. And actually in my book I show how you can measure the effects of the spirit and the soul and the mind molecularly, okay? The research is there. And if we dip down into that part of us, and then pay attention to the other aspects that feed that, healing will emerge. The origin of the word heal, whole, and holy are the same. And in fact, in actual practice, they are the same. So, how do we get from healthcare to health? If the healthcare system is generating more wealth and health, and we have a foot in it and are operating it on a day-to-day basis, how do we actually be part of the solution if the goal is that we create health and well-being? And what I'd like to do today, and what you're going to hear with Dr. Sugar after me, is some specific ways you can do that where you are right now, no matter what happens in the system. And that there are tools that can be implemented so that you're part of the solution of creating health and not simply delivering medical care. Let me illustrate this with an example of a patient of mine. I'll call him Joe, who you will all recognize immediately. So Joe is a 69-year-old Navy veteran. I saw him in a military hospital where I still see patients in family medicine residency. And he came to me, got impaneled after he had an MI, and was told to follow up with me for his primary care and cardiac rehab. Here's his history briefly. His father had an MI at 65. That's when he stopped smoking. His dad died at 75 of a heart attack. At 42, he developed hypertension. At 30, after he left the Navy and the weight standards were no longer enforced, he gained weight and he stopped exercising because he didn't particularly like exercising. Then he showed up with type 2 diabetes at 55, and he had platinum medical care. So I know there's a lot of discussion about people that don't have medical care. Clearly, we need people that have medical care. But here's somebody that actually has that. He has the top. He has access to any kind of specialist, all types of care. All of his medications are free, etc. Okay? So he's got universal health insurance, all right? And he comes in to me. And what Joe has had, which most of our patients have, is he's had a lot of soaps, a lot of soap notes, right? Anybody here not know what a soap note is? No, because you've got to do it every single day, right? It's embedded in the electronic medical record. You know, when I talk to lay audiences, practically nobody knows that they're being put in a soap box as soon as they walk in the office. And in fact, the soap box, the assessment, which has to have a CPT code attached to it that's going to get paid for, and a plan, which has to have some kind of evidence to support the activities of evidence-based medicine, drives medical care. It drives the research, it drives the delivery, it drives our thinking, and it drives reimbursement. And here's Joe's soaps, and he had a lot of them, and this is typical of someone who has platinum health insurance. He had hypertension, he was on a couple drugs for that, high cholesterol on a statin, he was put on metformin when they diagnosed him with diabetes. When they told him he had obesity and he should go see the dietitian, he went over to the dietitian for one visit and said, I know more about food than she does because I spent my entire career in food. Joe had been the food guy in the Navy, okay? He had been the guy always supplying food. He was the cook on a PT boat, and then he supplied food for aircraft carriers, then entire bases, and then he was a consultant for food for the entire Navy at some point. He'd been food all his life. He was now post-myocardial infarction. He'd had a stent put on a beta blocker. The stent and the intervention probably saved his life, and this is what we're really good at. We're really good at actually stopping people from dying. When an acute manifestation of a chronic disease happens, or when an acute disease happens, like an accident or infection where we know what the cause is, or or when we have a mechanical problem where we can replace it with something that works, like a knee, for example. We're great at that. It works fabulous. It helps people. But when it comes to preventing that or reversing chronic disease, we are terrible at it. We do not have a system, actually, that delivers chronic disease prevention and reversal or management. His chronic disease management was cardiac rehab. And I was supposed to help supervise that with supervised exercise. And as I mentioned, Joe hated exercise. This is platinum level health insurance. Now, if we all suddenly, if there was a magic wand waved in our political system and suddenly everybody got this type of health insurance, universal health care coverage, how much health would that actually produce in the population? How much does medical care actually contribute to population health? Think about it for a minute, okay? Any optimists in the group? Anybody say 50%? Would it go up 50%? No? Should I go up or down? Down, okay. 30%? Down. 20%? A few? 10%? Okay. If we're not producing health, then we need to not simply have universal health coverage. We need to think about what we're actually doing in healthcare. We need to change what we do. If we simply do what we're doing, and everybody's like Joe, we get what we've got. We are first in spending, we're 37th according to WHO in health outcomes. 25% of our GNP by 2025 will be spent on healthcare, unsustainable. And this widening expense is driving disparities farther and farther apart, increasing disparities, and driving the haves and the have-nots who have access to this into increasing disparities in equity. The Institute of Medicine, or National Academy of Medicine, now did one of the best summaries of this several years ago. Multiple pieces of data have now come out to confirm this. The report is called Shorter Lives, Poorer Health, chaired by a family physician, by the way, Steve Wolf. And it showed that of the 12 major population health outcomes of importance in rich countries, OCDE countries, of which the United States is one, the US over the last 30 years has been falling behind and declining in 9 of the 12. We're very good at two things. If you get to 65, you're going to live longer than in other countries, and if you have cancer, you're going to live longer. We're very good at keeping people alive. This probably shows more than anything the declining value in what healthcare does. This is graphing life expectancy on the y-axis to per capita costs of a whole bunch of countries around the world, and you can see the US is a major outlier. We spend twice as much as any other country, and yet our life expectancy is about the level of Portugal or Czechoslovakia. We are no longer getting value from healthcare. Why? We know that too. Population health actually doesn't come from what you do in the office right now. It doesn't come from the pills and the procedures and the soap notes that Joe got. The vast majority of health comes from outside of what most of us do. It comes from behavior and lifestyle. You're going to hear about that just a minute. And it comes from the social and the economic determinants, which are really things that either enable people to make the behavioral changes necessary to stay healthy or heal, or impairs that ability to do that. Those are the two major things, and then the physical environment is a third component of that. And so if we want to actually deliver health, we need to get out of that top little part of this graph and begin to look at and figure out how to address that. Now, you can do that every single day in your practice, and I'm going to give you and show you a tool that I use every single day. It's hard to do in 15 minutes. You can do it in 30 minutes, okay? A little more time might be good. But what it really requires is that the dialogue in the day-to-day interaction with our patients change. They come in with certain expectations for pills and procedures. We conveniently put them in the soapbox to give them pills and procedures, and then we seek how to get those paid for or covered or addressed in some way. And then the system allows us to do that, right? Because it's not being driven to do anything else. It's a cultural issue. But the bread and butter of healthcare delivery is that encounter. It's that dialogue that you have multiple times a day with a patient. So simply changing that conversation can begin the process of the probably the most profound healthcare revolution that we can have. I propose that you do that with something called a hope note. After you've done your SOAP notes, then begin to ask about the personal determinants of health for your patients through a healing-oriented practices and environments note. That's what it stands for. And it starts by asking about the most important thing for a person in their life, by asking them what matters instead of just what's the matter. Why do they get up in the morning? Why do they even want to have health? If you can hook your activities to that, you're doing not only patient-centered care, but you have in fact created the most powerful healing driver there is, which is them. And then ask about these underlying determinants that we usually don't ask in the behavioral and in the social environment. The spiritual and mental questions are what matters. That's at the core of a human being, as my friend who is even dying from lung cancer. The social and emotional components are essential for healing, and we need to ask about that. The behavioral and lifestyle components, people are realizing now, and we're trying to figure out ways to actually do that. We'll hear more about that. It's key. And then the physical aspect. Most of the time, we touch the physical and the body on the top. We don't get below to the other aspects of a human being. Taking care of a whole human being means we know these factors, and it starts by asking what's the matter and what matters, and then what's the matter. We've already asked them what's the matter. So here's what happened with Joe. Joe comes in, I call this an integrative health visit, not an integrative medicine visit, an integrative health visit, and I'll show you what I mean by that in a minute. But Joe came in and we did an integrative health visit, and I did a hope note for him. And I started out by asking what mattered to him. Now, the first thing he said, which many patients say, is that, man, I got all these drugs, okay? He was on a lot of different medications, and they get switched around. The cardiologist had said this, his primary care doc and I had different opinions about that, et cetera. He wasn't sure how to organize that, and I said, okay, Joe, we have a pharmacologist on our team, and I'll help be your manager for this. We can take care of that. Excuse me. But what's the most important thing for you in healthcare? Why do you even want to come in? He says, I'm 69. My dad died at 75. I don't want to do that. I've got a family, I got grandkids, et cetera, et cetera. I want to live beyond 65. I want to prevent further disease. That was the most important thing to him. He knew that fitness and food were an important part of that, but he wasn't sure exactly how to do that. And he certainly didn't like the fitness part, which is the part was paid for, and he could go in his cardiac rehab part. But the food, that was him. He'd spent 30 years in food. He needed to identify some help, and that help had to come from his family and friends. Excuse me. Here's his normal routine. He'd go into the club in the evening, he'd get a burger and french fries with his buddies and a couple drinks, and they'd sit around all talk about their health and their medical visits. He said, I know that this is where I need to figure out how to change that culture in there. But the most important thing to him was that when he was in the Navy for 30 years, he was doing something really important. He was defending the country. He was helping, his buddies do their job. He was helping hold bases, and eventually the whole Navy. When he retired, he's not doing that anymore. He lost what? He lost his purpose. He was a give back to society kind of guy. That's why he went into the Navy. And then after he retired, he hadn't figured out how to continue to do that. So this was the perfect setup to figure out how to organize his team. Here's his integrative medicine team. We knew exactly what he needed. He needed a conductor to listen to him and help coordinate stuff, but not do anything. That was me, not do anything, but just help organize stuff. He needed a pharmacologist because he really needed needed some help in terms of managing his medications. Maybe he should have been on the beta blocker or whatever. We needed to coordinate that component. He needed a nutritionist, but not the way the nutritionist had approached him the first time, which is, okay, here's a diet, do this. Okay? He needed somebody who was going to actually act more as a behaviorist or health coach and support that. And as it turned out, he needed somebody to help him in that, so he needed like a health coach, and he wanted to learn how to cook in a healthy way. And he was a chef. He'd been a cook. Okay? He needed his family and his friends to get on board with this. He needed to somehow either change those or get them to be involved in it. And he needed to start thinking about how he could use this to get back his purpose in life. As it turned out, there was a program that was started for people that had heart attacks in the community center. It was called Healthy Eating Class, and it involved a nutritionist, same one he'd seen in the hospital. But now she was providing nutritional advice, a chef that showed you how to put it together, he loved that part, and a health coach that then helped you embed it in your life, worked with your family and friends, and your own behavior component. 12-week course, had lots of recipes, he enjoyed that. After 12 weeks, he lost 5 pounds, he felt better, and he said, how come this isn't available to me 30 years ago? Okay? And I said to Joe, that's a great question. Okay, why don't you create one and make it available to people like you 30 years ago? And he said, okay, I'll do that. So he went to the community center and he said, I'll be your chef and I'll be your coordinator in that. And he set up a program that was now available for people at risk, or actually then eventually anybody that wanted to get into that. Fast forward a year later, he taught now 4 or 5 of these courses, and he himself had now lost 40 pounds. He was off all except one hypertensive medication. He no longer had diabetes. And his risk factors had gone down. He felt better. He was less likely to die at 75 now of his heart problem. And he was giving back to society and found his purpose. His soul had returned. This is a different type of health care, right? Well, yes and no, okay? It involves the management of what we do every day, conventional medicine in the top circle here, but it also involves so-called complementary and integrative approaches that didn't used to be part of that, but most important, it involves self-care. It involves helping people to get empowered and take control of their own life. And it's this juxtaposition of these three areas within the cultural context that we have, and sometimes the social context, the social determinants don't allow that and have to be addressed to allow that habit. This is integrative healthcare. This is the kind of healthcare that family physicians should be the leaders of and excel in. To encourage and support self-care should be the primary component. To integrate evidence-based conventional complementary lifestyle practices. And the evidence currently shows that if you do that, in fact, people will heal much better no matter what you're doing. Can we do this in our system? Is it possible to do this in our system? Right now, I'm going to challenge you to go ahead and do it in your system. There are large systems doing it. Here in the military, they like to consider themselves first out on everything, and they have been first out in this area. Here are residents, family medicine residents getting trained in something called battlefield acupuncture. It's actually not acupuncture. It's little gold studs. There's no needles. There's 5 points on each ear, and in one day you can get trained to use it. It's been tested in randomized studies and observational studies to reduce acute and to help maintain lower chronic pain. So it's now being taught to everybody in the military, from the medical assistants, the medics, to the primary care docs, to the nurses, even to the pain specialists as an intervention to go in. Okay? The Surgeon General, the first nurse Surgeon General, last Surgeon General in the Army, her signature program was called the Performance Triad. Sleep, nutrition, movement. It was being taught to the medical side, okay? The units already knew, at least some of that. They knew the movement part, the nutrition and sleep they didn't know much of. But the medical side was now doing it. That was the signature program. So nutritional education, mind-body practices, stress management practices were all part of that program spreading throughout the military. The VA is right on the heels of that. This year they opened up 18 centers of excellence all around the country in integrative health. It's called Whole Health. Take a look at it. They have a huge number of tools that are all free, taxpayer funded, and you can download them, adopt them, and use them in your own practice today. It is a radical revision of how healthcare and primary care is delivered along the lines of what I just showed you. Now, we're starting to do this also outside in the civilian sector, but we're focused on a very small group that's costing us a lot because we're focused so much on the money. 5% of those who walk into our offices or come into the clinic are taking up 50% of our healthcare costs, and so our healthcare system is focused on that 5%. And what they primarily focused on is keeping those with advanced illness out of the hospital, out of the emergency room, and out of specialty care. And you all have been charged with doing that. I didn't know you have done that. And when you do that, you save a lot of money because of all the money that Michael Fines talked about being wasted in our healthcare system. But what about the other 95% that are on their way towards that if we don't do anything about it? What about those at high risk or those with complex diseases that don't fit into the advanced illness category? That's the other 50%, and it's 95% of the population. We need a system that manages that not only prevents people from getting there, but even reverses that process. We need an integrative system. So that the system at the top 5% is called integrated care. It involves care coordination, works with hospitals, EDs, primary care and specialists working together to reduce that, reduce unnecessary lab imaging and medication prescriptions. That's an integrated care. We need an integrative system to address the other 95%, and that's where you all could shine and can shine. By focusing on health creation or health promotion, lifestyle is both prevention and treatment. Health coaches, integrative medicine providers on the team, bring them into that process, and reduce lab imaging and probably a bunch of supplements that your patients are taking that they're maybe not telling you about. In policy areas, this is called value-based medicine, right? Bundled care, and we're trying to go from volume to value. Unfortunately, the lines around value have been drawn very narrowly, not around all of primary care, and they need to be drawn around all of primary care. So we've got one foot in the value-based boat and one foot still on the volume-based dock, and the boat is leaving the dock. Where are we going to be when we can no longer bridge that gap? Well, you can start to be in the boat right now. And here's what you can do. Yes, continue your good medical care, as you do. You have to operate within the system. But then add in an integrative health visit. And you do it through two ways. You can do this fairly quickly with something called the personal health inventory that I give my patients and say, come in and have a visit with me where I'm going to ask about your personal determinants of health. I'm going to do a whole, I'm going to do an integrative health visit. Personal health inventory starts with what's the matter. With what matters, sorry. Not what's the matter. They've all had the soap notes. Reframe the questions and the dialogue. Add some simple techniques, ear acupuncture, mind-body practices, nutrition, safe supplements. Pull in technologies that can facilitate this process. There's some great technologies that can help with that. Most of my patients won't go to an 8-week mind-body meditation or mindfulness-based class, but they will engage in something like heart rate variability biofeedback, okay? I can show them how to do that, teach that. My health coach can do that, or medical assistant can do that. I can do it with them. And actually, most of my patients like that because it's right in front of them, and it gets them into a relaxation state that they can see and monitor and measure. Lots of other devices, health apps, telehealth, et cetera, that can facilitate this program. Probably most important is just redesign the teams. You've got the resources there. It's just being spent over a longer period of time in a disjointed way. Some of them aren't there, okay? The nutritionist or the chef is not somebody right now we know how to pay for, so we have to figure out how to do that. Yoga practitioners, yoga therapists in my system aren't paid for, but in the VA they're being hired by the dozens, okay? So it is possible to do this and they're saving money. do some of these things in there. So on my website, there's resources. We have a toolkit actually on how to do an integrative health visit, how to use the Hope Note. You can download the personal health inventory, give it to your patients. It creates a tremendous opportunity for discussion in those areas. Then do the questions that deal with the whole person, as I've illustrated in those areas, and start them on their journey in those areas. I'm in the great, fortunate environment now where I'm funded actually by a nonprofit foundation that just wants to get this out into primary care. And so I'm looking for examples of things that work out in primary care. And so if you're doing a lot of this already in various forms, which I know many of you are, contact me. Let me know, email me. You can email me directly at healing@drwaynejonas.com. You can download the toolkit in those areas, try it out in your practice, give us some feedback in those areas. You don't have to wait until the magic wand occurs and everybody has universal platinum healthcare insurance. You're going to wait a long time probably if you're waiting for that. But you can be the agent for healthcare reform right now